Herbal Wisdom TV. What if a simple leaf growing on a guava tree could help calm mild diarrhea, support digestion, reduce sudden blood sugar spikes after meals, improve oral health, and even support your skin, but only if you use it correctly? Stay with me, because most videos online either exaggerate what guava leaves can do or completely ignore safety. Today, you learn the real benefits, the simple science behind them, the correct ways to prepare guava leaves, and the biggest myths you must avoid. Welcome to Herbal Wisdom TV, where traditional herbal knowledge meets modern science, explained clearly, honestly, and without hype. This video is for educational purposes only. If you are pregnant, breastfeeding, diabetic, have a chronic medical condition, or take prescription medication, always consult a qualified healthcare professional before using guava leaves medicinally.
By the end of this video, you will understand exactly how guava leaves work, when they help, when they don't, how much to use safely, and how to test whether they actually work for you. So please first like this video and subscribe to my channel. Please subscribe so that YouTube can push this video further to other people. And the most important thing is that turn on the notification button so that when I drop more educative and health informative videos, just like what you're about to watch right now, YouTube will send the notification instantly. Now, let's dive deep into today's video. First of all, guava leaves come from the guava tree, scientifically known as Psyllium guajava. These leaves contain several powerful natural compounds such as tannins, flavonoids, quercetin, and polyphenols. These are not mysterious chemicals. They are natural plant defenses that interact with the human body in measurable ways. Tannins are compounds that tighten tissues. Inside the gut, this tightening effect can reduce excessive fluid loss and slow bowel movement. That's one reason guava leaves are traditionally used for diarrhea. Flavonoids and polyphenols are antioxidants. They help reduce inflammation and oxidative stress, processes involved in digestion problems, blood sugar imbalance, gum disease, and skin irritation. Quercetin is a specific flavonoid found in guava leaves that has antimicrobial and anti-inflammatory activity in laboratory studies. In the mouth and on the skin, this helps reduce bacteria and calm mild inflammation. In the digestive tract, it can reduce spasms and soothe irritated tissue. In simple terms, guava leaves help calm, tighten, and protect, but within limits.
Let's talk about the most reliable benefits, starting with the most proven one. The first one is diarrhea, the most reliable use. Guava leaves are widely used for mild diarrhea. The tannins reduce intestinal secretions and help slow down rapid bowel movements. Many people notice fewer trips to the toilet and firmer stools within a day. That effect is practical and repeatable for mild, non-severe diarrheal episodes, those caused by food irritation, mild viral gastroenteritis, or minor bacterial upset. How this works in plain language. Tannins bind to proteins on the gut surface and reduce secretions, while flavonoids soothe irritated muscles and lower cramping. The combined effect is less fluid in the stool and slower intestinal transit, which is exactly what you want for mild diarrhea. What to expect? Improvements within 12 to 48 hours for mild cases. What to watch for? If symptoms are severe, include blood, or last beyond 48 hours, you must seek medical care. Severe dehydration, fever, and bloody stools are medical emergencies. Another one is oral health, gums, plaque, and bad breath. Guava leaf rinses work because of two actions, antibacterial and anti-inflammatory. The leaf extracts reduce common mouth bacteria and soothe inflamed gums. Used as a cooled mouth rinse, guava tea can help reduce plaque accumulation, ease mild gingivitis, and reduce halitosis or bad breath caused by bacterial overgrowth. How to use? Make a gentle tea. Let it cool. Rinse for 20 to 30 seconds and spit. Do not swallow if you used a high-concentration brew intended for short-term mouth rinsing. Use once or twice daily as an adjunct to brushing and flossing. This is supportive oral hygiene, not a replacement for a dentist when gum disease is advanced. The next one is bad breath, a straightforward benefit. And for your own information, bad breath is a serious and big problem to many people, and therefore, if you are watching this video, now you have got the solution. Because guava leaves reduce bacteria and soothe the mouth, they can reduce volatile sulfur compounds, the gases that cause bad breath. For many users, a short course of daily mouth rinses reduces noticeable odor, especially when bad breath is related to poor oral hygiene or mild gum inflammation. Then the next one is for supportive but not a cure, that is for diabetes and wound healing. There is promising but limited human evidence that guava leaf extracts slow carbohydrate digestion and reduce post-meal blood sugar spikes. In simple terms, some compounds in the leaf partially block enzymes that break down complex carbs. That slows glucose release into the bloodstream. What that means practically, guava leaf tea may reduce the height of post-meal glucose peaks, which can be helpful as part of diet-focused blood sugar management. Important caveat, this is supportive. It is not a treatment for diabetes. If you take diabetes medication, adding guava leaf tea could change your blood sugar, so monitor closely and consult your clinician. Never stop prescribed medication without a professional plan. For cuts and wound healing, guava leaf poultices and topical extracts show real antimicrobial activity and can support healing in mild superficial wounds. The leaf provides a mild antiseptic environment and antioxidants that support tissue repair. This is supportive skincare, useful for small scrapes and as part of hygiene after cleaning a wound. Deep, infected or surgical wounds require professional medical care and proper dressing.
Now we must talk about misinformation, because this is where many people get hurt. One dangerous myth is that guava leaves cure diabetes. This is false. They may help reduce blood sugar spikes, but they do not reverse diabetes or replace insulin or medication. Another false claim is that drinking guava leaf tea daily will prevent all diseases or make you immune. No herb does that. Health comes from many factors, not one tea. Some channels promote extremely strong guava leaf brews, claiming stronger is better. This is incorrect. Excessive tannins can irritate the stomach, cause nausea, and interfere with nutrient absorption, particularly iron. Strong, prolonged intake may also cause constipation in sensitive people. Another harmful myth is that guava leaves can treat all diarrhea, including severe infectious diarrhea. This is dangerous. Severe diarrhea requires hydration therapy and medical supervision, oral rehydration solution, possible antibiotics or antiprotozoal drugs, and sometimes hospital care. Finally, guava leaves do not cure cancer. Lab studies are interesting and may support future research, but they are not human cures. Anyone facing cancer needs professional medical treatment.
The truth is simple. Guava leaves are supportive herbal tools, not miracle cures. So most of the channels will be telling you those dangerous and harmful myths, and if you are not very careful, what they tell you will not work and you will end up misled and disappointed. So be very careful. That's why I tell you to subscribe so that you get approved and proven researched herbal remedies here on Herbal Wisdom TV. Therefore, please, you subscribe. Now, let's talk about how to prepare guava leaves correctly. So here is a practical recipes you can follow. Basic daily guava leaf tea may help you on oral health and general supportive use. So number 1, wash 6 to 8 fresh guava leaves thoroughly. Number 2, add them to about 3 cups, 700 to 800 ml to water.
Number 3, bring to a boil, then reduce heat and simmer gently for 8 to 10 minutes. Number 4, remove from heat, steep for 5 minutes, strain. Number 5, allow to cool to comfortable temperature. For oral rinse, use a small sip, swish 20 to 30 seconds and spit. Finally ready for drinking, 1 cup after a meal is appropriate. From there, here is a stronger short-term tea for mild diarrhea. You will have to use 10 to 12 fresh leaves in 4 cups, about 950 ml to water. Then boil gently for 12 to 15 minutes, strain. Drink 1 cup every 4 to 6 hours while symptoms persist and monitor hydration. Keep total intake within several cups per day and stop if you feel nausea or constipation.
Now, you may want to use dried leaves. If using dried leaves, use about 2 tablespoons per 3 cups of water and steep for 10 to 15 minutes. Strength will vary by drying method. Start with a lighter brew. Let's talk about the external or topical paste for small cuts or skin inflammation. Here, you are going to first wash leaves and crush them into a paste with a mortar and pestle or blender. Patch test on a small area for 24 hours. If no irritation, apply a thin layer to the cleaned area for a few minutes, then rinse. For open wounds, use only on clean superficial scrapes. Do not apply to deep or infected wounds without medical advice. Storage and shelf life. This stage is very important. Fresh leaf tea, use within 24 hours and refrigerate. Dried leaves, store in an airtight container in a cool, dark place for several months. Discard if musty. Safety and interactions, the most important part. Now listen very carefully. Let me start with diabetes medications. If you take insulin or oral hypoglycemics, guava leaf tea could amplify blood sugar lowering effects. Monitor glucose and talk to your healthcare provider. Do not make medication changes on your own.
Another one is iron absorption. Tannins can bind dietary iron. If you are iron deficient, avoid drinking high tannin guava tea with iron-rich meals or iron supplements. Wait 1 to 2 hours after a meal or supplement. Then, pregnancy and breastfeeding. Avoid medicinal doses during pregnancy and breastfeeding unless your clinician approves. Limited safety data exists for high amounts. Children and infants. Small children may take diluted teas with clinician guidance. Infants with diarrhea require medical evaluation. Don't rely on home-brewed teas alone. Allergic reactions. Rare but possible. Stop if you develop rash, swelling, breathing problems, or severe stomach pain. Overuse. Excessive tannin intake can cause nausea, constipation, and decreased mineral absorption. Use moderate doses. If you experience stomach pain, rash, dizziness, or worsening symptoms, stop and seek medical advice. Let me also talk about this one because it's also very important for you to know. How to test whether guava leaf tea works for you, a 7-day trial. That's how smart herbal use works. Test, observe, adjust. Before starting, rate your digestion, bloating, bowel consistency, energy, and comfort from 0 to 10. Keep your diet and routine the same. Drink 1 cup after a main meal each day for 7 days. Track any changes in symptoms, energy level, and stool consistency. If you see consistent improvement, continue cautiously. If no benefit or if you notice side effects, stop. If you are using it for blood sugar support, check glucose before and 1 to 2 hours after a meal on days 1 and 7 to compare. Don't change your medication without medical supervision. Common questions and their quick answers. Question 1. Can children take guava leaf tea? Answer. Small diluted amounts can be used for older children with clinician advice. Infants with diarrhea need medical care. Question 2. Can I use the fruit instead of leaves? Answer. Guava fruit is nutritious and contains vitamins and fiber, but the specific medicinal compounds concentrated in leaves, tannins, and certain flavonoids are less abundant in the fruit. For the medicinal effects discussed here, leaves are the preferred part. Question 3. How quickly will I see results for bad breath? Often within a day or two when bad breath is caused by oral bacteria and poor hygiene. If bad breath persists, see a dentist. Question 4. Will guava leaf tea cause constipation? In some people, strong tannin-rich brews can cause mild constipation. Use moderate doses and stop if that happens.
Therefore, to summarize, guava leaves contain tannins, flavonoids, and polyphenols that can support digestion and mild diarrhea relief, help oral hygiene and bad breath, and provide supportive benefits for blood sugar control and skin healing when used appropriately. They are affordable, accessible, and useful when used correctly, but they are not cures. If this video helped you understand guava leaves clearly and safely, give it a thumbs up and subscribe. Don't forget to subscribe to Herbal Wisdom TV for more science-based herbal guidance. Hit the bell to get notified when we post another educative and informative health herbal video. Share this video with a friend who needs reliable information instead of hype. Leave a comment for the next video that you want me to make for you next, because I will respond to your comment and make that video for you. Thank you for watching. Use nature wisely, and I'll see you in the next video on Herbal Wisdom TV. Shalom. I sign out. Bye-bye.